Hi, I'm David Palmer. I'm an otolaryngologist. That means ear, nose, and throat. I think I became interested in that because I have had a history of allergies myself. It runs in my family. So I actually chose a specialty to help me with my own nose. The most common allergens in the spring are the trees. And the tree pollens in the Wasatch Front are birch tree, elm tree, oak tree, maple. Everyone brought their favorite tree to the valley. So instead of just a desert, now we have a blooming allergy fest. Well, you have the typical symptoms of itchy, runny, sneezy, and blocked breathing. Those are the common ones, but there's some uncommon allergies that can make you quite tired, or it can make you a little grumpy, or perhaps it makes you snore, or perhaps it makes you have asthma in the lower airways. So allergies can manifest as nasal, itchy eyes, asthma in the bronchial tubes. You can even get it in your skin as eczema. So there's several ways that allergies can show up. Allergic asthma typically shows up as an evening symptom, a nighttime cough, perhaps in a child who's not otherwise sick, may be one of the first signs of asthma. But wheezing is the tip-off that you may have asthma. And it often runs in families again, and it can be related to an exposure like, say, a cat. So whenever the person is around the cat and they start having swelling up of their eyes, their nose runs, and they start wheezing, that would be allergies of the nose and of the lower respiratory tract. One is to avoid the exposure if it's possible. The second is medications. And the third would be allergy desensitization or allergy shots. And that's what I actually went through as I was treating myself originally. I would try to avoid the grasses and the weeds by staying indoors, but that was no fun because I wasn't going outside and enjoying the outdoors. So the next step of treatment would be medications, and there's a lot of good medications that are now available over the counter. You've heard of Allegra, Claritin, Zyrtec, and to varying degrees they are somewhat successful, but they're not always successful. Some patients, like myself, needed something beyond just the medications. So the next step, if you can't avoid it and the medications aren't enough, is to actually get allergy shots and to become desensitized to the allergens that you're specifically allergic to. The shots begin weekly in the first year, and then they advance to every other week in the second, third, and fourth years. And I try to push my patients to 5 years total, but not everyone wants to do shots that long. You can go off the shots and still have allergy-free days for many years to come. Yes, I begin at age 5, and in the future there will be approved an allergy tablet. It's actually in the research stages right now, but I expect the FDA will be approving this towards the end of the year. And this will be much easier for children because they don't have to worry about the needles, the pain of getting a shot, and you could do this at home yourself. I can't think of any insurance company who withholds coverage for allergy treatments. As I said, you want to try lesser things first, like medications. I'm kind of the last hope, or allergists like myself want to treat these patients usually with something a little more than just over-the-counter medications. One of the important messages I want to get out is that you can prevent allergies from going on to complications like asthma. If you treat the allergies early on and prevent this allergic march, we call it, then you can prevent the complications of asthma and also chronic sinusitis.